Have you ever considered home health care for yourself or a loved one? Choosing the right service can be confusing. Just like doctors or hospitals, no two health care providers are the same. So it's important that you do your research before making this all-important decision. Kate Jones is the Chief Clinical Officer with the Medicis Home Health Care. Thanks for being here, Kate.
Thanks for having me.
I want to talk about this subject. It's so important. What types of home health care services are there?
I'm so glad we have a chance to kind of go through these today because it is so confusing. There are multiple kinds of home care. So when you think about home health care first, think about skilled home health care, which is the type of care that's ordered by a physician and requires a registered nurse or a physical therapist, a skilled clinician to come into your home and provide care. So that's one type of care. Another type is a more personal assistance type of home care. You'll see a number of providers in most communities that offer to come in and help with bathing and dressing and maybe even housework and shopping and errands and those types of things.
And meal preparation.
Meal preparation, yes. So that's when you need not medical care in the home, but personal and supportive assistance in the home.
Right.
Two different types.
And they call that help with activities of daily living. You'll hear that. ADLs.
Correct.
Or activities of daily living.
Yes. And there are even some who provide help with what's then called IADLs, instrumental activities of daily living, that are things like bill paying, grocery shopping, transportation to doctor's appointments. Those are a separate type of home care provider from the skilled care that we talked about first.
Okay. And then it goes on. We have palliative care and hospice care.
Right. So hospice care in the home is a type of care for individuals who are at the end of life. They have a condition that, if it runs its normal course, is expected to end their life within the next 6 months. They've chosen at this point that they don't want to go through curative treatments anymore, that what they're looking for is pain and symptom management and help through that process of life. So palliation is actually a subset of hospice care. And palliative care, in many instances, can also be provided separately. So again, I know it's all confusing. These are a lot of different types, but hospice care, think of as end-of-life care. Palliative care is about pain and symptom management. And some locations you can get palliative care separate from hospice care, but palliation is always a part of hospice care.
Right. And what I understand is the skilled care post an event, okay, is covered by Medicare or a managed care. The home health care services that are private, help with activities of daily living, are not covered. That's out of pocket. And then we get into palliative care and hospice care. That's also a covered Medicare benefit or managed care benefit.
Correct. So let's take the two on either end first. So home health care and hospice care at home are both Medicare covered benefits. The Medicare benefit for home care requires, of course, a specific set of eligibility requirements. So, you have to be homebound. That doesn't mean you can never leave your home or that you have to be bedbound, but it does mean that you're essentially confined to home because of the limitations of whatever illness you have or the health situation that you just went through.
And what's important to remember is that there are options if you want to stay at home from beginning to end.
Absolutely. So, we talk about a continuum of care.
Thank you so much, Kate.
You're welcome.